Good afternoon and welcome everyone. My name is Dr. Prag Moodley. I'm a GP in Stevenage and also the chair of Eastern North Hertfordshire CCG. Thank you for taking the time to join us at our annual general meeting, especially after the fantastic night we all had last night. Couldn't resist mentioning that. I'm really pleased that even with the COVID pandemic, we have all found a way to be here, even if it's virtually. You might have joined us for our last AGM in September, when being online was still somewhat of a novelty. Hopefully this has enabled some people to join us who may not have been able to before. I understand that we have many staff, volunteers, valued stakeholders, and members of the public, which might make it our biggest AGM yet. You might have also joined our first ever statutory joint AGM this morning with the two other CCGs in our area, Herts Valley and West Essex. During the meeting, our formal presentation of the accounts took place, as well as a presentation from our Chief Executive, Jane Halpin. If you were unable to make it, the meeting was recorded and will be online soon. We will share a link with all attendees. Before we go any further, just a quick bit of housekeeping. The team are going to do their best to keep this session running smoothly, but technology can have its moments, so please use the chat function to alert us to any issues in hearing or seeing the meeting take place. The chat function can be found if you click onto the icon that looks like a speech bubble. It depends on what your device setup looks like, but hopefully it is easy to find. We are using the same chat function to collate any questions for the end of the meeting, so please do use it as much as you want to while we're all talking. The more the merrier. We will try and answer as many questions as possible, but if we don't get to yours, we will try to do this after the event. If the internet connections drop out for anyone on the meeting who is presenting or who is managing the meeting, please be patient with us whilst we try to fix it. There's a plan B and possibly a plan C, if things cannot be rectified, of course. So I would like to take my bit of time to thank all the hard-working and dedicated members of staff from all clinical disciplines working across Hertfordshire. Without them, the NHS couldn't survive. We're lucky to have some very dedicated clinicians working in the CCG. They help us to understand commissioning from both a patient and professional perspective. So thank you from me and on behalf of my GP colleagues on the governing body. Whilst I'm on the subject of thank yous, I have to say thank you to my whole team in the CCG and my comms team for putting this event together so successfully, I'm sure. And I have to thank all of you, our patients, for your patience during this pandemic. I would also like to give heartfelt thanks to all key workers who have kept us all safe and protected during this pandemic. We have had pharmacists supporting the delivery of medicines to shielded patients, volunteers assisting in lots of different ways, including marshalling patients at vaccination clinics, people working on phone lines to help lonely and vulnerable people, care home workers being a lifeline to care home residents who have been unable to see their families, and many people in important roles. I would struggle to fit that all in this welcome. I would like to share a particular thank you to those involved in the vaccination program, as this has proven to be a major turning point in the fight against coronavirus. I would like to make special mention of my colleagues in general practice and our primary care networks in helping us deliver a very successful vaccination program. Just this week, we have reached 1 million residents having had a vaccination in Hertfordshire and West Essex, which is just outstanding. Obviously, through this year, we have seen the positives of people pulling together to support one another. We can't forget that COVID-19 has caused a lot of heartache for many, so I would like to take a moment to remember those lives lost and send my best wishes to their friends and family members. What we're here to do today is provide some information about local health services. Next, you'll hear from Sean Elton, our CCG's Managing Director, to sum up our year. We will then take a moment of time to answer any questions you have. I do hope some of you are signed up for one of the 2 workshops on offer straight after this. They are both really interesting topics. These are taking place at the same time from 12:50 to 1:30, but will be recorded so you can enjoy the other workshop after the event. I will now hand you over to Sean. Sean.
Thank you very much, Prague. And thank you again for taking the time to be here and for Prague for welcoming us all here today. As Prague said, I am the Managing Director for Eastern North Hertfordshire CCG, and it is a privilege and a responsibility to lead this organisation, which is one of only a few in the country to have been judged by NHS England to be outstanding for 4 years running, which we are extremely proud of. I'm going to look back at what has been achieved this year, but before I continue, hopefully it hasn't escaped everyone's attention that the NHS marked its 73rd birthday on Monday. Obviously, the celebrations we might normally hold are still restricted, but we took some time out with colleagues in our 3 CCGs to have a virtual tea and cake break and reflect on what has been a year like no other. We want to thank everyone for your support and the support that you have shown to the NHS over the last 18 months. Firstly, although COVID has dominated all our lives, I want to cover the achievements we made in 2020-21. We have continued to strengthen our primary care workforce by expanding the range of clinical roles in GP surgery and primary care networks. Primary care networks describe the groups of GP surgeries in a local area, and in Eastern North Hertfordshire we have 13 PCNs. Having these networks now means that physiotherapists, pharmacists and paramedics are working alongside doctors, nurses and healthcare assistants, making it easier for patients to see a health professional with the right skills quickly. The social prescriber role in primary care has grown greatly. GPs, nurses and other healthcare professionals support patients by referring them to a social prescriber, which is a non-clinical role. Social prescribers support patients to get the help they need more quickly and reduce the number of appointments needed at GP practices. Each of our primary care networks employs a social prescriber who supports patients by doing things like putting them in touch with local support organisations, making proactive phone calls to carers of dementia patients to ensure that they are supported, as well as making doorstep deliveries and welfare checks for vulnerable elderly patients. As you can imagine, their work in the past year has been fundamental in helping those most vulnerable in our community. In Hertfordshire, a team of community navigators now provide help both in the community and in hospital, accessed through the Hearts Help advice line and website. This is coordinated across the integrated care system area and is a partnership of charities and voluntary sector organisations. It is a community-based service which helps support the discharge of patients home, supports people to complete forms and applications, helps with prescriptions and much more. Both of these services offer vital support to people in our communities who might be feeling isolated. I'm thinking particularly of carers, who we know have felt enormous strain over the past 18 months in looking after their loved ones and themselves. I'd like to pay tribute to those unpaid carers and the work they do. If you know of a carer, please ask them to talk to their GP practice so we can help them access the support that's out there for them. In September, anti-coagulation services in North Hertfordshire, which are provided for people who take warfarin, were successfully transferred to a new provider, Hertfordshire Community NHS Trust, with no interruption in the service for patients. During the transition period, patients were asked about their views about the change of the service provider. Some were concerned, as you can imagine, about going somewhere new for services, as many accessed the clinic via their local GP practice. The CCG and the Trust worked together to ensure that patients could use existing sites, which was great news. In December, NHS 111 introduced an appointment system for A&E as a way to help keep patients safe and hopefully ease waiting times and pressures in hospitals, and in particular within emergency departments. It is vitally important that everybody who needs urgent care is seen and treated safely in the right place first time. Waiting for hours in an emergency department to be seen for a minor injury or illness is not in anyone's interest. By picking up the phone or dialing 111 or going online to 111 via their website before making the decision to travel, patients can be assured that the right clinician is expected to see them. This campaign is known as NHS 111 First, and I hope you've all seen the advertising about it in the past few months. Population health management, known as PHM, is an increasingly important aspect of what we do as commissioners, as well as leaders across the health and care system. It uses health and care information to identify the needs within our population so that we can determine the priorities and support the development of transformation projects and help us measure the impact of what we do locally within our system. It has been a busy year for the population health management teams, despite the pandemic. Within the CCG, there have been some interesting projects delivered. CCG staff have worked with public health team within Hertfordshire County Council to develop a modelling tool to track the course of the pandemic and help us to determine the services patients were going to need to access. This enabled us to work with and support our health and care partners to plan, expand and change the way that services were delivered. A good example of this is the development of the COVID virtual ward, which I will talk about later on. Between the first and second wave of the pandemic, we did a review of evidence to assess the needs of our population across a range of healthcare areas, including, but not limited to, long-term conditions, cancer, frailty and end of life. In addition, during last summer, an external organisation helped the CCG support the development of population health management across our primary care networks. This work has supported the identification of local health needs within each PCN, enabling PCNs to design bespoke services to address the needs of their local population and improve health outcomes. One of the workshops today will look at this in more detail. But if you can't join, as Prague has said, we will be recording these sessions and uploading them onto our website. Plans to make much needed changes to Mount Vernon Cancer Centre services are being developed and will continue over the next few months as part of a large-scale review by the local NHS and NHS England, which started in 2019, but was obviously paused during the early stages of the pandemic. Further information about the review, why things need to change and what is happening can be found at a dedicated website, which we are going to write into the chat function for you, or can be found by searching Mount Vernon Review. Healthwatch Hertfordshire help people to find out about local health and social care services and listen to people's views and experiences of using those services. Healthwatch have run 3 surveys to better understand patient experiences of health and social care services during the pandemic. The surveys focused on the effect of that COVID-19 has had on mental health, the experiences of those who have been shielding, and on health and social care more generally. With the help of East North Hertfordshire CCG, 667 people shared their stories, and Healthwatch have published their report entitled COVID-19, patient experience, learning from Hertfordshire. This report is on their website, and again, we'll put a link to that in the chat. The report details their findings and includes recommendations to service providers across Hertfordshire. The CCG is working with Healthwatch to implement these recommendations. Local practice improvements and new buildings have been a key activity for the CCG and something which is really important for the well-being of people in the local area and the staff using them. Hayley View Surgery in Hoddesdon have increased the number of clinical rooms and upgraded others. Other schemes which include moving Parsonage and South Street surgeries into Herts and Essex Hospital in Bishop's Stortford. Bishop's Park is moving to Stortford Fields, and we are extending Puckeridge surgery. The extension and improvement plans at Stanmore Road surgery in Stevenage are all underway, and Wallace House will be moving into the Birchley Green development in Hertford. So as always, lots of amazing work being undertaken within general practice with the support of our very capable estates and premises team. The biggest area of our work continues to be keeping residents healthy and safe from COVID. When COVID-19 hit, the whole of the NHS and the country had to adapt the way that services were delivered. I'm going to go over some of those service changes in East and North Hertfordshire. Please bear in mind as I'm talking that COVID has hit outside the reporting year of 2020-21. So some of what I've described covers last March. Our GP practices have risen to the significant challenge presented by COVID-19. Although they are working differently, practices are very much open and here to help patients with their health concerns. During the first wave of the pandemic and following guidance issued by NHS England in improvement, GP practices focused on delivering priority care, supporting people with long-term conditions, ensuring that those with mental health needs were supported, and keeping childhood immunisations up to date. Our GPs continued to refer patients for tests and treatments for suspected cancers and sought advice and guidance from secondary care clinicians where needed. But much routine and elective care was paused to allow hospital staff to prioritise care for patients with COVID-related illness and respond to emergencies. Last March, our practices began to triage all appointment requests from patients to ensure those really needing a face-to-face consultation could be prioritised and patients who could be helped online or by telephone were assisted in this way. Telephone appointments and virtual consultations such as video calls were received well by many patients, and I really want to thank everyone who's been able to adapt quickly to the new way of communicating with their GP. For some of our practices, patients can use an e-consult system which is available on the practice website to ask a question or to complete a questionnaire for medical advice. This enables people to get help and advice safely without needing to be seen face to face if that is not necessary. During 2020-21, more than 228,000 e-consultations were submitted. GPs have been able to work in a more flexible way, including from home while self-isolating, thanks to the efforts of our IT provider, HBLICT, in improving equipment like laptops and cameras and putting in place the appropriate secure systems to manage patients more remotely. Information governance protocols were updated, enabling sharing of data to take place across groups of practices. These additional measures have been hugely important in ensuring general practice continued to provide safe and effective services for patients throughout the pandemic, whilst reducing the risk of outbreaks. During the first wave of the pandemic, as the number of patients seriously ill with COVID increased, GPs set up new ways to monitor those patients who were unwell but didn't need to be admitted to hospital. Virtual wards were established in some areas, including Stort Valley and villages, where patients were provided with oxygen saturation monitors so that they could monitor their own saturation levels and stay at home. The patient's GP practice contacted the patient daily to discuss their symptoms and ensure that the right care was put in place to continue to manage the patient safely at home or refer to hospital for additional care if required. During evenings and weekends, the virtual ward was run by a GP working as part of the extended access team. This helped patients to be cared for at home and to allay their worries in a potentially frightening situation. The CCG worked with system partners to implement a large-scale virtual ward in response to wave 2 of the pandemic, when there was significant and sustained pressure on healthcare services. Long COVID virtual clinics for those experiencing ongoing symptoms and complications of having the virus were set up in some primary care networks areas during the summer and autumn, offering virtual support and face-to-face group consultations when government restrictions allowed. In November, Hertfordshire Community NHS Trust's COVID rehabilitation service was launched to provide physical and psychological support for patients. The service is run by a multidisciplinary team, which includes a community GP, pharmacist, physiotherapist, pulmonary rehab staff, respiratory nurses, speech and language therapists, dietitians, occupational therapists and clinical psychologists. The teams work with colleagues in social care, hospitals, mental health and the voluntary sector to deliver a holistic approach to each patient. Care homes were heavily affected by COVID, especially at the start of the pandemic. We delivered infection prevention control training to all care homes in line with the national timescales, and we continue to deliver this training to all care homes, supported living and domiciliary care providers. Multidisciplinary teams came together to support care, residential, nursing, learning disabilities, supported living and assisted living homes during the outbreak. Due to restricted visiting in care homes, the CCG has also worked with Hertfordshire County Council to implement remote monitoring to ensure safe care is maintained and strengthen processes to ensure professionals visiting the homes in a clinical capacity, such as GPs and community nurses, can provide feedback about the quality of care being provided. To help care homes maintain contact with primary care and community services, each care home was supplied with an iPad. The iPads were to be used for training and supporting care home staff. They were also used for face-to-face appointments so that residents could continue to be assessed during COVID and receive medical reviews. The iPads were supplied free of charge to care homes and delivered to all care homes in the area. The COVID vaccination programme has been one of the success stories of the past 12 months. Plans were developed very quickly and have been responsive to changes brought about by vaccine supply issues, adjustments to the priority groups for vaccination and changes in guidance for second doses. The collective effort and goodwill shown by GPs, their practice staff and our colleagues in community and hospital trusts, as well as the enthusiasm of the general public, should not be underestimated. We have now rolled vaccinations out to all over 18s and good progress continues to be made to ensure everyone can take up their vaccination locally. All our vaccination sites have also been supported by dedicated volunteers who have selflessly given up their time to help vaccination clinics run smoothly. With routine hospital care paused for a period during the pandemic, waiting lists for some treatments have significantly increased this year. However, throughout the pandemic, the local hospital trusts have continued to prioritise diagnosis and treatments for patients with cancer. Hospital teams are assessing all patients on their waiting list to ensure that those whose clinical needs are most urgent are prioritised for treatment. Clinicians, including GPs, use national guidance from the Royal Colleges and their professional judgment to make these decisions. We are monitoring progress in tackling waiting lists to ensure higher risk patients are prioritised and initiatives are being deployed to bring the waiting list down for all. I really want to stress to everyone that NHS services remain open and we continue to treat people as quickly as possible. prioritising those with the most urgent clinical needs. Additional outpatient clinics and surgical sessions are being run in the evenings and weekends across our providers, including our local independent sector hospitals. It is important that any care delayed due to the pandemic is prioritised according to need. This is an opportunity for me to remind everyone here that if any patient feels their symptoms have changed or they have new concerns, it's really important that they contact their GP practice or the department they are receiving treatment from, so our clinicians can ensure they continue to be fully supported. Before I finish, I want to say a final thank you to all NHS staff, wherever they are working in our system. NHS staff are a resilient bunch, but the pandemic has taken a tremendous toll on everyone. As a good employer, it is vital we do all we can to support staff wellbeing. The Here For You programme offers 24/7 confidential help for anyone working in health and social care, and I would encourage any staff member who needs some advice or support to take up that offer. Thank you for taking the time to join today's meeting, and I hope my report has given you some substantial information and assurances to take away and reflect on. If you can please urge loved ones to take up the vaccination opportunities available locally to get better protected against COVID, and tell family and friends how they can access NHS services in different ways, it will really help us spread the message. I am now going to pass you back over to Prague to have his final say and explain the next part of our AGM. Thank you.
Thank you for that, Sean. I would like to thank everyone for posting questions in the chat. We will now go through as many of those as we can, and any unanswered questions we will try and answer at some point and publish the answers. So I'm going to hand back over to Sean. I just briefly scanned the questions, and I think most of them probably you would be best placed to answer. So maybe the one most relevant which you spoke about because of the frailty pathways and how we're linking all our providers together and how we're making it count. Maybe if you speak about that, a similar question to what we had in the joint AGM, Sean. So if you respond to that, and let's see which question.
Okay, thanks, Prague. I'm just trying to pick the question up so I make sure I don't miss any of the pertinent points.
It's will there be improved links between primary care services and other services supporting individuals in their own homes? There's often inconsistency with sharing information outside of primary care services that impact on the individual.
Yeah, absolutely. And we did. Thank you, Prague. We did touch on this in the statutory AGM earlier as well. So there are a number of strands to this. So one of the key one is around the kind of integration of digital systems, and so there is has been a lot of work that's gone on in the last couple of years to make sure that GP practices and the community teams who work for our community provider can access patients' records, see the same information, and more importantly ensure that there isn't kind of double entry onto systems, which obviously can increase risk at times. There's always more that we can do about that with regards to that, and one of the things we're engaging with in now is about how can we extend that digital integration to include social care information, which is as important as access to health information, as people will know that a lot of our local population will also be in receipt of support from social care and voluntary sector organisations, particularly the older and frailer members of our population, and therefore it is vitally important that we do as much as we can to ensure that there is access to those records. And the ICS has a digital work stream which is working to try and tackle all of those issues. And as part of that, there is a digital inclusion work stream. And again, I think that was raised in the statutory AGM earlier, that we need to make sure that as part of this work, we don't risk losing or not including sectors of our society, either because they don't have the access to fund digital resources, so that to access to tablets or PCs or other devices in their own homes, but also to ensure that we train and educate people so that they can increase their confidence of using devices. The kind of work we've done today seems to suggest that those are the two things that are kind of the rate limiting factors. Access to Wi-Fi isn't the kind of predominant issue. It's the access to the equipment that you need to be able to support remote monitoring or keeping people safely at home. And alongside that, increasing the confidence of people so that they know how to use those devices and that they maximise the usage as well. There's a question here from Sally Newton about trying to ensure that we kind of promote and communicate all of the agencies that are out there, because I think Sally's suggesting that quite often people just aren't aware of what's available. And I think certainly, Sally, during the pandemic, that's become very evident. And the work that the Hertfordshire County Council did in particular with setting up the voluntary people in assisted cell really brought that issue to bear. And I would like to think in the last 12 months that we have made some advances in terms of making people aware of the services that are available to them, with a primary route for kind of that access being through carers in Herts in the main instance, who can then do the work to help signpost, but also through the development of the social prescriber and other roles that I talked about earlier. I think, I guess the other important strand to this is to say that actually we are working with the voluntary sector to develop a strategy, and Tim Manfilagoff and his team are leading on that piece of work, and I think that will be very welcome and really supportive in terms of some of the things that we know that we need to try and achieve.
And Sean, can I just add that PCNs have care navigators and who will probably be able to help patients a lot more in navigating this in terms of putting them in contact with the best people available and making them aware of all the resources that are available. So I think that will help us to tie this all up a lot more. Care navigators and social prescribers within the PCN networks will help to deliver this a lot more effectively and joined up. Sean, maybe if you do the question on how is the CCG getting ready for winter?
Okay, yeah, sorry, I hadn't read that one yet, but I can do. Yeah, so we have an annual planning cycle, as you can, I'm sure people can imagine, around developing our plans for winter. And this year, more than important than ever, because we've got winter plus COVID, and again, as mentioned earlier in the statutory AGM, we're already seeing presentations now of illnesses that we would normally expect to see in the winter period. So we know this winter is going to be difficult for us. But we have an annual cycle of business in terms of being able to identify the schemes that we needed to put in place to support winter, there is some very specific pieces of work that we need to make sure, services that we need to make sure are in place for this year, particularly the ongoing development of the virtual wards and the long COVID services, as well as ensuring that the out of hospital discharge schemes continue to run. You know, Alan alluded to the fact earlier in the statutory AGM, the funding for that service in the second half of this year, there's some unknowns in relation to that currently in terms of the funding streams coming down from NHS England, but we're absolutely certain and clear that that needs to be one of our priorities going into this winter. So there will be some strengthening to our winter planning this year, because we've got the opportunity to make sure that across the 3 CCG footprints that we have a very coherent and comprehensive plan, and that we are ensuring that we're learning from each other in terms of our experiences over not just last winter, but the winters that have gone before us. And that planning is kind of clearly a whole system planning, includes all partners across all agencies, including obviously the acute trusts and the ambulance services, as well as the 111 provider and our community providers. So we are planning and we are getting ready for winter now, as I'm sure you can appreciate.
So, Sean, I think there's 2 questions there where we might get Sam to come in and help us out on as best place. So one on the prevention agenda, Sam, and the second one on how the learning from all of this might be shared locally and used.
Great, thanks, Parag. I'll take the question about the debrief and learning the lessons first, if that's okay. I suppose this is part of what we do on a day-to-day basis. As part of all of the transformation projects that we do, we tend to undertake lessons learnt, go through a lessons learned process at the end of those, so that we can pick up on what went well, what could have been done differently, and build that into the work that we take forward. The other thing which obviously we undertake as part of any pilot or any new service that we put in place is a form of evaluation to understand exactly whether those new services or new ways of working have achieved the outcomes that we're wanting them to achieve. The other thing, actually, yes, going forward, we obviously want to continue this work, but Sean mentioned it earlier, that between the 2 waves of the pandemic, we took stock of the current situation and where the health and care needs of our population were at, and that is again something which is a continual process. And so keeping our finger on the pulse of what the health and care needs of our population are supports us to understand where our priorities are and where we need to look at new opportunities for transforming services. So sort of in answer to that question, it's part of what we already do and have been doing through the pandemic, and what we will continue to do, and as part of that, we work very closely with all of the partner organisations across the CCG, across the Eastern North Herts patch, to kind of learn together and develop together. So I think that probably describes some of the processes that we have in place in terms of debriefing. And so that will be a continual process going forward. On the other question, if I can, unless others may want to add to that previous question around keeping people healthy and avoiding illness in the first place. I guess I've got a few points that I wanted to make on that. Firstly, is that there's been enormous changes in the last year or so. Putting the pandemic aside, actually, with the developments within the NHS, there have been expansion of new roles within the primary care and primary care network setting, with care navigators and social prescribers roles coming through, which obviously start to make those connections between what is classically health services and what will be provided within the wider community, and actually making use of those community assets is really the key to supporting people to stay healthy in the first instance. And so that really draws on the wider network across the patch. That's both from other statutory organisations, but also from the charitable and voluntary sector. And so it's kind of where we make those connections and how we use the developing primary care networks to really make those links and support people in those ways. The other thing, which is probably a little bit more around the area which I'm working on, which is around how we keep an eye on understanding what the health needs of our population are. So going back to the previous question, but also where we've got inequalities and actually what's driving those variations in outcome, and actually helping to identify what factors and what issues there are that may be driving those higher prevalence or incidence of conditions and diseases, and then actually designing services that are going to really tackle those. And that's where the session after this around population health management may start to answer that question in a bit more detail and give you one or two real world examples of how we're doing that in practice within East and North Hertfordshire. So obviously it's part and parcel of everything again that we're trying to take forward, but this is where actually that networking and partnership working is going to really come to the fore when it comes to prevention.
Thanks, Sam, for that. It's a really comprehensive response, so thank you very much. There's quite a detailed question about NHS digital GP data capture, which I'm going to ask Avni to respond to. So thank you, Avni, for picking this question up.
No worries. Good afternoon, everybody. So my name is Avni Shah. I'm the Director of Primary Care across the 3 CCGs and ICS. Just as the question has highlighted, it is a planned project which is absolutely happening, which is scheduled from 1st of September. And the question really is very much around, does East and North Hert CCG fully support it? We do support it. However, we are absolutely working together across Hertfordshire and West Essex with all our primary care colleagues and LMC to make this as smooth as possible. What we are awaiting for at present is the national communications to absolutely understand what does the opt-in, opt-out mean. This will have an implication for primary care staff, which we have already highlighted to the regulators above, and we've got to be absolutely be considering as to what that would mean in terms of what for the patient's opt-in and opt-out process. So what we have done so far at present is sent communications out to all our general practice across Hertfordshire and West Essex, advising them in terms of that we are awaiting further guidance, and that we'll be working very closely with the patients and the public to actually make everybody understand of what this all means, because we all want data sharing when it's in the right way. So that's where we are at present. So further information to come through. Thank you, Sean.
Thank you. Thanks, Sean. I think that's all the questions you've dealt with now. And they know there's a thank you from Linda Pryor. Thank you very much, Linda, for appreciating all the hard work that my team has done over this pandemic. Yeah, thank you. There are no more questions. And so after this, we will, you now have a choice of going out into 2 different workshops, and the topics you can see, one's about telemedicine and digital health, and the second one's about population health management. So the links to both are available, and you can choose either one. We're hoping we'll get an even distribution of participants in each. The recordings of the both event sessions will be made available, so you don't be left out, and you can listen to the discussions that have taken place. So we are now going to go into a short break, and then immediately after the break, please join at 12:50. Click on the links and join the relevant meeting that you're interested in. Thank you all, really appreciate it.